Hope you're fine. Usually we care our teeth, natural teeth, like twice a day brushing, once a day flossing, to avoid any damage like dental caries to our teeth. But sometimes due to any trauma, any fracture of teeth, crack in the teeth, or any developmental problem, we have to undergo tooth extraction. After tooth extraction, what are the various options of replacement? Usually there are four options. Number one, leave the space, but this is not a good option as in this model there is a space after the tooth extraction, aesthetically unpleasing, and the opponent tooth in the upper arch will extrude, will supraerupt, and will touch the bone of the lower jaw with the passage of time. The teeth adjacent to this space will tilt toward this space, and the whole structure of mouth will be deranged. So this option is not a good option as there are consequences or complications of leaving the space after the tooth extraction. Second option is starting from the cheapest one is removable partial denture. This is a removable partial denture made up of acrylic and the teeth are also made up of acrylic. In between is cast metal. Cobalt, chromium, nickel, chromium, different alloys are used in the fabrication of this denture. This is cheap option, but the problem is removing the denture daily and cleaning is very important. If you don't clean your denture, there is chance of accumulation of fungus over the denture area, which ultimately results in mouth infection. Also, denture lead to bone loss of the jawbone. So there will be loss of retention of the denture with the passage of time, and the clasp affect the adjacent teeth. Chances of caries in the adjacent teeth due to these clasp arms. Second option, which is better than this option, is dental bridge. Bridge, as the name depicts, there are two pillars, and in between there will be a pontic or artificial teeth. Like in this case, there is a space, and we have to drill the adjacent sound teeth in order to get support for fixed denture. This is costly than the removable partial denture, but aesthetically more pleasing, and ceramic is biocompatible and good to our gums, easy to clean, and as a fixed option we don't need to remove it. But the problem is we have to grind the sound adjacent teeth which are healthy. So this problem lead to problem in the future. So ideal option is the next option. The fourth one is dental implants. Dental implant, we usually drill in the bone and place the conventional implant, and after 3 to 4 months place a crown on the top of it. But there are also a good option. If a patient wants a quick fix option, then we have option of basal implants, also called as mono implants. We drill the area of the jawbone and place the basal implant, and after 72 hours we place a crown made up of metal, ceramic, or zirconium on the top of the basal implant. So this is very easy and quick fix option. And another advantage of basal implants is we don't need bone grafting as we usually need in case of conventional implant. So these are the all are four options of artificial teeth replacement. But last thing which I like, maybe it will implement in the upcoming future, is biological tooth replacement. We will utilize stem cells in order to form a new tooth called as biotooth. That is the ideal option as it will be like a natural tooth. Contrary to it, the artificial options are made of like removable partial denture is acrylic or a plastic material. Bridge is ceramic like a stone, and dental implant is made up of titanium. So ideal option will be in the upcoming future will be the biological tooth replacement with the help of biotooth and stem cells. Hopefully this video will be informative to you. If any question related to this you can ask in the comment box. Thank you.